Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Health Ministry launches training program on emergency life support. The Union Health Ministry has rolled out a training module on national emergency life support for doctors, nurses and paramedics. This training module will lead to the creation of a pool of trained doctors, nurses and paramedics in the country with skills to provide standardized emergency life support and reduce mortality due to medical emergencies. The course is comprehensive and deals with the management of medical emergencies, surgical emergencies, cardiac emergencies, respiratory emergencies, including ventilator management protocol for COVID-19 and other disease trauma-related emergencies. Doctors move to Supreme Court against NEET SS 2022 examination pattern. Challenging the changed exam pattern of NEET SS 2022 examination, the aspirants of the entrance test belonging to MD Radiation Oncology and MD Anesthesiology have approached the Supreme Court. The grievance of the petitioner doctors are against the new pattern for the NEET SS examination that consists of 150 questions from the general component of the primary feeder broad specialty subject and from all subspecialty systems component of that primary feeder broad specialty subject. Besides, the petitioners are also upset by National Medical Commission's draft postgraduate medical education regulations, which proposes deletion of MD Radiation Oncology, radiotherapy as an eligible feeder specialty qualification for the super specialty course of DM Medical Oncology. Government doctors do not have vested right to claim vacant posts, said High Court after it junks gastroenterologist plea. Dismissing the plea by a doctor seeking regular establishment in SCB Medical College and Hospital, the Orissa High Court has recently clarified that even if there are vacancies, a doctor does not have any vested right for claiming those seats. Declaring that such decisions are to be made by the government, the High Court bench comprising of S.K. Panagrahi held that even if vacancies are there, the petitioner does not have any vested right to claim for such post since it is under the absolute domain of the government. The Health Department is under no obligation to appoint him in SCB Medical College and Hospital, QTAC. Sun Pharma to launch Brillo, a first-in-class oral lipid-lowering drug in India. 1 in 4 deaths in India is now because of heart diseases, with ischemic heart disease and stroke responsible of this burden. These diseases tend to affect patients in the most productive years of their lives and result in catastrophic social and economic consequences. Sun Pharmaceutical Industries announced that one of its wholly owned subsidiaries plans to launch a first-in-class oral drug, bempedoic acid, in India for reducing low-density lipoprotein cholesterol. The company will launch the drug under the brand name Brillo. Brillo is a first-in-class drug which has a new mechanism of action compared to the currently available lipid-lowering agents. It is indicated for people who have an inherited genetic disorder that causes high cholesterol levels or established heart diseases where cholesterol levels remain high despite lifestyle changes and the use of maximum tolerated dose of statins. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.